And they would say, it's your upper back, or you've got one leg longer than the other, or it's your glutes, or it's your hip flexors. I saw pain specialists who put me on huge amounts of medication. I was on thousands and thousands of milligrams of different medications. At one point, I was on 7 different medications, and none of them were making any difference.
Welcome to The Story Behind the Symptoms, a podcast from Symptomatic.me. Your host is David Clark, MD, a board-certified gastroenterologist who successfully diagnosed and treated over 7,000 patients with neuroplastic pain or illness. Each episode, we dive into our guests' life experiences to uncover the deeper causes of their symptoms. By listening to their story, you will gain insights that advance your own journey towards knowledge that becomes healing.
Hello and welcome to the Story Behind the Symptoms podcast. I am your host, Dr. David Clark, president of the Association for the Treatment of Neuroplastic Symptoms. And in this podcast, we talk to people who have suffered these conditions about where they might have come from and how they were successfully overcome. And my guest today is Sarah, who is coming to us all the way from New Zealand. Sarah, would you please introduce yourself?
Hi, David. Thanks very much for having me. I feel very privileged to be a part of this podcast, which had such a role in my own recovery. I am in Christchurch in New Zealand. I was formerly a ballet dancer, and then I moved to running my own Pilates studio, and I'm now a neuroplastic recovery coach.
That's wonderful. Well, we always start in this podcast with people telling the story of their symptoms, when and where they began, and what their course was over time.
Okay. When I think back, I actually have probably been suffering from neuroplastic symptoms since I was about 18. I moved to the other end of the country to come to full-time ballet school. So I left my family behind, came down here to full-time ballet school, which was a challenging environment. And I very quickly started to develop some quite unusual symptoms. I would be frequently suffering from sinus infections or chest infections, or I'd wake up some days and my mouth would just be filled with ulcers, and I would just be bedridden for 2 or 3 days until I recovered. I had a lot of what they would have classified as overuse injuries in my Achilles and in my hip, but none of those really had a mechanism of injury. They just kind of lingered on and off as the 3 years of my full-time training continued. I made a decision at the end of that full-time training that I didn't want to continue to be a professional dancer, and I'd always loved movement, and I was really interested in the way the body worked. So I decided to head overseas and train with an international provider in clinical Pilates. Around this time, I started to develop very bad anxiety. And my anxiety would be up and down during the day. It would either be overwhelming heart palpitations, a real sense of panic. But then sometimes in the afternoons, I'd have this huge wave of fatigue that would come across me. And this kind of continued really for a very, very long time, maybe 10 years, off and on, sometimes much worse than others. But during this whole period, I was still reasonably functional. I look back now and think, gosh, how remarkable. I opened my own Pilates studio, which was very unusual in Christchurch. It really wasn't very well known. When I was 21, I started from scratch and I created this Pilates studio, and I really had a love of working with very complex clients. I only see patients one-to-one, and I really loved letting people find movement back in their body when they'd had a lot of fear. So it was a great job, but I was working long hours and it was financially challenging. My first daughter, when I'd had the studio for about 6 years, and it was very difficult to find qualified staff. So I made the very hard decision to make the business a lot smaller, and we built a little attachment to our own property and moved the Pilates studio then to our house, which is part of where some of my issues have come from, I feel like, because I felt like I was a failure at that point, because I could have kept going with my large studio. I could have got a nanny for my daughter, but part of me felt that I wanted to look after her more and not have her in daycare. But the other part of me also felt a bit like a failure, bit of a conflict, I guess, between those two parts.
Yeah, it's hard to be maximally successful in both areas.
That's right.
Probably impossible, but
It's absolutely impossible. But that decision actually turned out to be a blessing because um, some of the viewers may not know this, but Christchurch was hit with a series of catastrophic earthquakes. Between 2010 and 2011, we had hundreds and hundreds of earthquakes. Particularly in 2011, we had a very serious earthquake in the middle of the day, and 151 people died. Many others lost their lives, and the fabric of our city was forever changed. And earthquakes are funny things because you can't say they're finished. It's not an event that's finished. You just never know when the next one's going to happen. So for somebody who already had anxiety, it wasn't a great situation. Every time a cup would rattle or a truck would go past, very frightening. And I had 2 children by this stage who were little and also very frightened. But my real symptoms began in about 2014. There was 2 things that happened prior to that. One, my youngest was hospitalized with a very nasty unknown virus, and they were very concerned she had meningitis. She recovered, but my grandmother, who I was very close to and who was only 70, was diagnosed with a very severe glioblastoma. So
for our audience, a form of brain tumor.
and she only survived 11 weeks, and it was very traumatic. And very shortly after that, we had been on a short vacation, and my daughter had been in a porta cot, like a portable traveling cot. And when I'd picked her up, I'd thought, that feels a bit unusual in my pelvis. I thought I'd hurt myself lifting her, but I didn't really pay much attention to it. But as we were driving back from our vacation, the feeling started to get worse and worse. And it was around my pelvis. And it felt like someone had tipped acid all over my pelvis and down the side of my leg. So when you have that type of thing, I think it's very common that you would just presume you've got thrush or some sort of gynecological issue, although the pain was external. So when I returned, I saw my general practitioner who gave me thrush medication, which didn't work. Went to my gynecologist who gave me different thrush medication, still didn't work. They said, oh, let's put you on a 6-month course because even though the tests were negative for thrush, it must be thrush. And I kept saying, it's not really thrush. And it was coming down the inside of my leg. And by this
Yeah,
stage,
which thrush would not do. And of course, you can see thrush when you do a pelvic examination. And so if you're not seeing it and your tests are negative, what you have there is a good example of a clinician who believes that all pain and illness can be linked to injury or disease.
disease.
And they are trying to make your symptoms fit into that injury or disease model,
That's right.
even against all the evidence.
Exactly. And he said, oh, we just haven't found the right antibiotic yet. So then I went to a dermatologist who said, you're allergic to your washing powder. And I said, I don't think I am. I had actually tried changing my washing powder. At this point, I cannot stand any fabric touching my pelvis at all. And I said to my doctor, I can't have any clothing touching me. And he said, well, just don't wear pants. And I just sat there and went, you really have no idea what my life is like. You can't just not wear pants. You can't wear
And just for our American audiences, pants are underwear.
No, I mean trousers. Any
Oh, you
trousers.
mean trousers? Okay.
Anything. I couldn't have anything touching me. So, I mean, I have a business where I'm trying to see patients every day. I do need to wear trousers. So, I kept seeing different people. I saw every physio, and they would say, it's your upper back, or you've got one leg longer than the other, or it's your glutes, or it's your hip flexors. I saw pain specialists who put me on huge amounts of medication. I was on thousands and thousands of milligrams of different medications. At one point, I was on 7 different medications, and none of them were making any difference. And the more medications I had, the worse I got. I saw osteopaths, I saw nutritionists, I changed my diet, I tried everything. And I really was just getting worse. My anxiety was out of control. I needed to go on an anti-anxiety medication in the end because I was very panicked. Of course, all of this is now coinciding with COVID. So now we are in lockdown, which is, when you are self-employed, financially devastating. I'm trying to homeschool my children. I was sent for pain management services here, where they basically teach you to manage your pain. We had 5 sessions and they said, well, you're done now. And I said, but I'm not fixed. I'm no better than I was. In fact, I was probably worse. I was beginning to suffer from extreme fatigue. I would set my alarm in between patients so I could sleep for 20 minutes, just so I could function for the next patient. I'd pick my girls up from school and I couldn't sit in the car for 10 minutes because I would fall asleep. So every time I sat down, I had to set a timer. Otherwise, I wouldn't wake up. I was developing multiple food intolerances. I couldn't eat onion anymore. I couldn't eat garlic. I couldn't eat banana. They said, you've got irritable bowel. And of course, as I now know, that is the truth. The more foods I took out and the more worried I became about all of this, the worse the food sensitivities got.
Yes, when you're not making the correct diagnosis, it tends to gradually get worse and the number of symptoms expands and their tendency to move around the body also takes place and the severity of them gets worse. It's a pattern that should be ringing huge alarm bells for any medical clinician that a brain-to-body neuroplastic condition is responsible, because there's no single disease that is going to give a person the range of symptoms that you were suffering from.
No. And of course, I just was feeling like my body was completely broken. I'd been a ballerina. I was functional. I could do a lot of things. I loved to perform on stage. I was capable. And all of a sudden, I can't walk my children to the park 50 meters down the road because my pelvis is burning. I could
What finally turned this around for you, Sarah?
Well, it gets a little bit worse, unfortunately, before it gets
Okay.
better.
Okay.
So I eventually did see a neurosurgeon who I hadn't seen along any of this point, and he organized for me to have a nerve block into the pudendal nerve, which is incredibly painful. Takes probably half an hour to get the needle in the right spot to actually get the cortisone in. And I had to go through that process twice because we had to do both sides. It didn't really work. I had a little relief, but I suspect it was either probably placebo or it was just when the local had gone in that I felt a little better.
Yeah, the more difficult or invasive the treatment, the bigger the placebo effect is.
Yes. But he said, no, you definitely have pudendal neuralgia on both sides, so we will decompress your nerves. So I had a 5-hour surgery where they cut my pelvis from one side to the other and decompressed both nerves. To this day, I'm not really 100% sure that they've found anything. It's a little unclear to me. It's an incredibly invasive surgery. I couldn't sit down for a very long time. The recovery was very tough, but I was expecting that. I was happy to do that because I really was at the end of the road. But as I recovered, my pain moved to my tailbone. And the pain in my tailbone was intense. I'd always had a little bit of pain in the tailbone with my other symptoms, but I now could not sit down. I couldn't drive my car without extreme pain. And it was even hurting when I was lying in bed, which is always a place that I would have had relief previously. So I went back to the neurosurgeon and he said, well, now it's coccydynia, and the only thing we can do is cut off your tailbone. And I said,
And of course, no explanation for why on earth your pain would have moved from the front of your pelvis to the back. There's no reason for that other than a neuroplastic condition. And unless you have that in your consciousness as a possibility, you're going to have no idea about what's really going on.
And it's interesting because I actually said to him, but how do you know that when you cut my tailbone off, it's going to stop hurting? Because what about phantom limb pain? And he said, I don't know anything about that. So, yes. So I said, okay, actually, my husband said, do we have any choices, any other choices? And he said, either have your tailbone cut off or live in pain. And that just destroyed me, that one sentence.
Yeah. And how many other patients has he cut the tailbone? Well, I mean, I know you don't know that, but and then you multiply that by every neurosurgeon in New Zealand and many around the world. It's a massive problem.
So I go back to my car, my husband goes back to work, and I sob my heart out because how can this be my life? How can this be my future? And I go on Spotify and I Google on Spotify, chronic pain recovery. And I found a podcast, and the podcast I found was with Howard Schubner and Rangan Chatterjee. And that completely changed my life. By the time I got halfway through the podcast, I thought, this is me. And this is the only thing that makes sense to me. And for the first time, I actually felt like maybe there would be hope. And so I threw myself into learning anything I possibly could. Howard has a great free resource program on Coursera, which is basically a psychoeducation course. And the more I learnt about the science of the brain, my pain just started to slightly drop. And so I just completely threw myself into it. I started doing some journaling. I wrote 30 pages about my time when I was at ballet school. We might come back to that.
Well, yes, we will.
We will. And I decided to take Howard's Freedom from Chronic Pain practitioner training. And then I've gone on to train with PRT and with Charlie Merrill and a few other providers. And my pain is completely gone. My anxiety is completely gone. I can eat whatever food I want. And now I'm helping other people.
Yeah, it's wonderful to see what can happen when the correct diagnosis finally is made. Can you share with us any particular ideas that you came across in your learning about neuroplastic conditions that were most meaningful and helpful for you?
I think probably the first one is that pain is actually not the problem. It's actually the solution. It's actually the messenger. It's the messenger from the subconscious that something needs to change in our lives. For me, that was realization that I was putting myself totally last in everything that I did. I would ensure my children had a beautiful breakfast and a packed lunch and a home-cooked meal. I was volunteering on multiple committees. I was looking after my own patients in pain all the time. But I wouldn't eat anything. I'd see 5 patients in a day and not eat any food. I wouldn't even go to the bathroom sometimes. So learning that I was worthy of compassion and care, I think was really important for my healing.
Yeah, learning to put yourself on the list of people for whom you care.
That's right. One that I found, a thing that I found really difficult was finding joy again in my life because I realized I had no joy at all.
Surprisingly important issue in my practice. People who've watched this podcast before will know how much I emphasize setting aside regular time for activities that have no purpose but your own joy.
It's very clear to me in that kind of 15-year period that the times that I was the most well, I was involved in community theatre and in musicals. And that was very healing for me from my own dance trauma. But to be back on stage and doing that thing that I really loved, that my nervous system was really nourished by, was really important. But I really had to start with very, very small ideas like brushing my hair slowly or enjoying putting my moisturizer on my face slowly rather than rushing through everything. And because to me, everybody else was more important. The other thing I think that was very important for me was to realize that even though I think I dealt with a lot of my trauma consciously, I hadn't dealt with any of it subconsciously. And the feeling that I got with my anxiety really I didn't like it. So I just wanted it to go away without realizing what it was actually asking me and what was my subconscious trying to communicate.
Yeah, that's so important. And let's move into that a little more now. What was it that characterized what you've called the dance trauma?
So I did ballet from the age of 5. I was I was very good, but I was very aware from the very young, maybe 6 or 7, that I didn't have what they would classify as an easy body. I maybe was not as flexible as they would like you to be. Maybe my legs didn't turn out as much as they wanted them to be. So I really was aware at a very young age that my body was very important and it wasn't right.
Which is a absolutely horrendous message to receive as a child because
Horrendous.
it's making a statement about your value as a human being.
Yes. And of course, as I got older, that just got worse. So by the time I was 15, I was very aware of the fact that I was too fat, far too big. I was not. I remember, actually, I just remembered the other day, I had a reference letter from a dance teacher about me. It was to go for an application for a school. And I remember reading it, and it actually horrified me when I remembered this. It said, Sarah does very well despite her significant limitations in her body.
What a terrible thing to read at such a vulnerable age.
Absolutely heartbreaking. And then I move cities. I'm not with my family, and I come to full-time school, and it is very clear that they are not interested in anybody's opinion. You can't have emotions. You leave your emotions at the door. We were told that regularly. Emotions are not for the ballet classroom. If things went on that you didn't like, you were completely unable to speak up because you would not be cast in productions or you would just not be spoken to in class. So your behavior was how things would end up for you. So if you spoke up and you said, I don't like this, or I think the situation is bad, you would be punished.
And so from that, you're going to lose an essential signal, which is your emotions about how the world is treating you and how you're responding to it. And if you don't have that signal, then a large part of you just vanishes. And it contributes to the idea that you have to focus on the needs of those around you. Put your own needs on a shelf somewhere.
Yes. And that's before you mention the fact that they constantly weighed us. So you were being weighed every month and you would be put in a classroom in front of everybody and they would go around the room telling you how many kilos you needed to lose. So
Yeah, once again, a powerful message from people who are critically important in your life, who have power over what you want to do in your future. And they are once again sending the message that you are not good enough.
That's right.
And when people hear that message at a young age, the response is to redouble their efforts to be perfect, to redouble their efforts to meet the needs of everybody else, and redouble their efforts to take their own needs and stuff them away somewhere. And when you learn that over and over and over again as a way of living, it doesn't just stop when you leave the dance school.
No. And I think that's why I became a volunteer. I was the person that would run this committee or that committee or bake for friends or do someone's garden or all of the things for other people, but not for me. And
Yeah.
the only thing that I would do for me would be excessively exercise so I could be thinner.
Yeah, and it's once again, that's a response to a learning that you had about yourself that is false, an assumption that you absorbed about yourself that was false, that you are not good enough, that if you weigh a couple of kilos too much, that means you're not good enough. And so even that's certainly not a source of joy to exercise purely for the sake of your body image.
No.
And, if you're not able to believe in yourself, if you're not given the message that you are a valuable human being, then you can't internally give yourself approval. And so you're going to be seeking that approval from everywhere else, whether it's people on the committees or from your children or from anywhere. You need approval from outside of yourself because you can't give it to yourself from inside.
I think I had a very strong false negative core belief that I was really just not worthy.
Yeah, and I see that as very, very common in my patients. And there are numerous ways that this idea can be acquired. This false assumption can be acquired. The same thing can happen if, for example, your parents are fighting all the time, or if one of them is abusing alcohol. The child will try to solve those problems. They will fail in solving those problems, and they will absorb that message that they're just simply inadequate as human beings. And it's another way of winding up in the same place, that your only value as a person is in what you can do for others. Very, very difficult, because you don't have a parallel life to compare yourself with. Just this is what you grow up with. It becomes a core assumption about who you are, and you respond to it by never stepping off the treadmill.
And I think there's sort of those parallels between feeling like I'd failed in the ballet, and then I felt like I'd failed with the Pilates studio when I closed it down. I felt like I could have tried harder. I should have done this. I could have done that. I could have kept my mouth shut. But again, I was actually really being true to what I needed. I actually wanted to look after my children at that point. That was important to me.
Yes, and if you had been in a healthier environment, your mind would have reacted that way and would have said, you know what, I'm closing down my Pilates studio. I'm making a conscious decision to devote myself to my children, and that this is a better use of my time for me, my children, and my family as a whole.
Yes.
That would have been a very positive way to think about it. But if you are starting with the assumption that you are unworthy, then every change that you make can reflect that. And when you're doing this constantly on that treadmill and you don't have any internal guidance about setting limits or boundaries, then your body starts to set them for you.
That's right.
It begins to send you a message that it is in a state of distress.
And in the recovery, I've had to make a lot of boundaries. I'm not on any committees anymore, which is very freeing. I try to do something every day that is for myself, even if it's just to lie under a tree and look at the clouds and focus on something that's very grounding. But it's definitely a learning curve, isn't it? When you've had the personality type, or as you grew up, those are the things that you learned. Healing's not linear, and it's up and down, isn't it?
Yeah, 2 steps forward, 1 step back is a very normal part of the process. And you're unlearning assumptions that you absorbed at a very young age from people who were very powerful in your life and whom you admired. And it takes a long time to rewire the brain in a way that's healthier. I always ask my patients if there was anything with their families when they were growing up that might have contributed in any way to these assumptions, or was it in your case that it was primarily um, the dance environment that produced these problems?
There is definite trauma in my family as well. I'm the eldest of four, so I have three brothers. And from the time I was 2 years old, my eldest brother and then my next brother down suffered from a lot of medical events. So they were very, very frequently hospitalized.
Oh,
Must have been very frightening for my parents. They're all very well these days. It was things that they grew out of. But I feel like I was always kind of waiting for the next person to need to go to hospital, and my parents would not be there. And I wasn't left alone. I was cared for beautifully with other family members, but it was a very regular occurrence that the two boys were unwell. And my third brother had quite an accident when he was 2. So again, a lot of hospitalization. So I think that has made me medically anxious over the years, coupled with my grandmother and the brain tumor, that things can happen. And I think I was always a little on edge about when it was going to happen next. And I'm the eldest, so my brothers would tell you I'm probably very bossy. I like to help people.
yeah. Well, and probably quite responsible
Yes.
and taking care of details. And many
Mm.
of my patients grew up in homes that, for one reason or another, resembled a minefield, where on any given day they might walk through this field and everything's fine. And then on another day, something very bad happens. And when you're in that environment, you have to be constantly watchful. Most children feel some level of responsibility for bad things that are happening in their household, and they start paying attention to details and becoming watchful and anxious about when the next mine is going to explode. And that absolutely contributes to an anxious approach to life later on.
Yes. And I think that's very true. I was very aware that it would be easier if I was a very good girl and worked hard and achieved and didn't cause problems.
And maybe if you did all of those things, the mines in the field would explode less often. I mean, the children have magical ways of thinking about these things. They don't have that many options available to them to try to solve the problems or limit the adversity that's happening. And being a good girl, getting good grades, succeeding in extracurricular activities like dancing, those are all ways that children see that might help, might reduce the problems in the family and not being a bother. And you can learn to keep your emotions repressed even at that age, because if you're letting your emotions out, if you're expressing yourself, that's just going to be an extra burden on your parents who obviously already have a lot to deal with.
That's right.
So if you've learned to keep your emotions down and then you go off to ballet school where they tell you the exact same thing, you're already good at it.
Yeah, I was professional, although perhaps maybe I actually did stand up for myself on occasion
In dance school or at home?
in dance school. And of course, that had terrible consequences for me. So you would just not be cast in the production. If you stood up for yourself and you said, I don't like what's going on, you'd be punished. So again, that just taught me that it's not worth it. Just keep your mouth shut.
Yeah, and it's impossible to know what you need for yourself when the emotions are buried. The idea of taking a little more time to put the moisturizer on, that's a foreign concept for somebody who is unworthy and whose pathway to becoming a little bit more worthy is to make perfect breakfasts and perfect dinners and take care of 5 patients without eating or sleeping or going to the bathroom.
Exactly.
And yeah, it's a wonderful mechanism that our minds can let us know that something is wrong. And unfortunately, it has to do it through pain or illness, but it's still got that mechanism there to signal us that attention needs to be paid.
I just find it so remarkable when you see patients with, I mean, I had a lot of symptoms. You know, there's people with far more symptoms. I think I've heard you say that your top one had 27 different symptoms.
That's right. That's exactly right. A 21-year-old man with 27 different symptoms came to me with a printout from the internet, and he had circled each one of the symptoms that he himself was suffering from.
It's just remarkable to me that very few people can see that actually you don't have 21 things wrong with you. You actually have one thing going on. And the good news is that we can do something about that.
Yeah, well, when a traditionally trained doctor sees a list like that, they just want to beat their heads against the wall because they don't know where to start. Which symptoms should I evaluate? I'm not going to put this patient through the appropriate testing for each of the 27 different symptoms. That would be endless. It would cost a fortune. There would be some risk involved. So any doctor is going to want to, narrow that down a little bit and just focus on a couple of symptoms that might be coming from a serious cause. But even that's not very likely in a 21-year-old. And so the doctor is sitting there just going, all right, I'm going to order a couple of tests, but I know that the tests are going to be normal because there's no biomedical condition that can give somebody 27 different symptoms. But they don't know what else to do. They just assume this is a patient who's, can't handle their own stress. They're, neurotic or they're mentally not very strong. There's no treatment that is going to alleviate 27 symptoms.
Mm,
Person's just going to have to live with this. You heard all of that. And
absolutely.
yet there is a good solution to this, as you've pointed out.
Mm,
And when doctors learn how to do this work, they absolutely love it. I've told the story many times of a family doctor who took me aside at a conference and said, I took the course on your website and I'm now diagnosing and treating patients like this successfully. And it's put the joy back into my work.
It is cognitively dissonant, though, isn't it? When you first learn this work. I mean, I've come from a background of movement where I was telling people that their pain was from their posture and their biomechanics. And I did actually have some reasonably good results, and I've reflected upon that because I thought, have I done the wrong thing all these years? But I think a lot of the reason that I had results with some patients is more because I was their listening ear. I was the person that they could actually tell their life story to, and we could teach them to move safely. So it's more that part of it that I think I had success with patients, not the part of fixing their posture or the biomechanics.
Yes, there's no question about that. When you are open to listening to someone's story,
Mm.
you are sending them a message that their story has value. And consequently, they have value.
And that's so calming to their nervous system that,
And it's reversing their underlying assumption that they are carrying.
Mm.
And they start to make different choices. If there's someone toxic in their life, they will be setting some boundaries there. Or if they have an opportunity to do something for a few minutes that's enjoyable, they will be a little more inclined to believe that they are worth it just from your sending a message of value to them by listening to their story, even if you're not doing any of the neuroplastic psychotherapy kind of work.
It's very exciting to be doing this work. I feel very privileged to have found it. I obviously was meant to find it. If anybody had ever said this to me at the beginning, I probably would have punched them in the face. But I am now wholeheartedly grateful for the experience of my pain because it has brought me here to this remarkable life-changing work. And it's my hope that I can help other people who are going through similar circumstances. It's demoralizing and it's lonely when you're living with pain and persistent symptoms, as you know. And we don't have many options here. This work is very new in this country. So I hope that the word will get out more and more people will come across it.
Yeah, there's no doubt. When I look back 15 years, most of us who were doing work in this field did not know anybody else who was doing this work. And now at our conference for the ATNS last year, we had 350 people, including a lovely couple from New Zealand.
I'm going to come this year as well.
Great. Yeah, we look forward to that. Yeah, it's really a wonderful meeting of the minds and highly educational. Well, Sarah, thank you so much for sharing your story with us. I know everybody who hears this will benefit. Do you have any questions for me or anything else that you'd like to share before we close?
No, I don't think so. I would like to thank the ATNS though for all the remarkable work they're doing. It really is it's very kind, the amount of research that's been shared amongst the industry. Over here, been far away from anybody else. It's been super helpful to me professionally to have the connections. So I hope more people can find the ATNS and the services that they provide.
We are working on it. Thank you so much.